Hi.
Hi.
Auntie, can hernia happen to girls?
Yes, of course. Even girls can develop an inguinal hernia.
How? We don't have testicles like boys.
Correct. We don't have testes, but we have a uterus, and there is a round ligament which is running from the uterus, from inside the tummy to outside along the inguinal canal, so as to fix the uterus in one place. And when the deep inguinal ring around this ligament stays open, or if the canal stays patent, it can lead to an inguinal hernia.
Do we need surgery for this?
Yes, we do need surgery to correct this hernia.
But why? Why can't we let it be?
Okay, I understand that this is just a swelling in the inguinal region. So if it's not bothering you, feel why operate. But you have to understand why is there a swelling. The swelling is because either an ovary or intestine or omentum or maybe bladder is prolapsing through this inguinal canal. Now, when the ovary is prolapsing, it is possible that the ovary can undergo a torsion, which leads to gangrene of ovary, and we can lose this ovary forever. And also, if there is some intestine or omentum which is prolapsing, then they can also undergo twist and turn, bands can form and lead to obstruction. In such a case, we will need an emergency, major surgery will have to be done. So it's better done electively in a controlled situation.
Doctor, Auntie, will there be a big cut?
Yes, you don't have to be worried about the cuts. These are very minor cuts. So today almost 99.99% all female inguinal hernias are operated laparoscopically. By that I mean there are going to be 3 tiny cuts. One is going to be a 5 mm cut in your umbilicus, which will be completely hidden over there. Then there are 2 tiny cuts, either 5 mm or 3 mm in both the lower areas just above the inguinal canal, which become very faint over a period of time. Something like maybe this, right? You can barely see these scars. Okay, and also today we are doing a single port laparoscopic surgery for inguinal hernia repair, where all these 3 ports will be put only through the umbilicus. So no other scar, and later on probably you will not even remember or understand that whether a surgery was actually done or not, because there will be no scar seen outside.
Doctor, when will we operate them?
Yes, that's a very good question. So when to operate? So as I told you that there is a swelling, it could be ovary, intestine. So the earlier the better, because we don't want a surgery in emergency. A control situation is much better handled.
What about boys?
Of course, in boys also the surgery needs to be done fairly early. So for example, I had this baby, it was a neonate, my patient, and we had planned this hernia repair because he had a huge hernia, bilateral. So we had planned it for a Monday morning, and it so happened that the Saturday evening itself, it was irreducible, there were obstructive symptoms, and we had to operate him in an emergency.
How long I will stay in hospital?
Yes, nobody likes to stay in hospital for long. So hernia surgeries, laparoscopic inguinal hernia repair is almost always done as a daycare basis. You walk in the morning, the surgery is done by afternoon, evening, we discharge the patient. Only in tiny babies, sometimes less than 6 months, we may keep these babies overnight for observation, mainly from the anesthesia recovery point of view. But most of the times it's almost always done as a daycare procedure.
Thank you, doctor. I will tell my mommy daddy.
Thank you.